Hello, thank you for joining us on the ACEP Capital Minute, a bi-weekly look, at the latest developments from the nation's capital that impact emergency physicians. I'm Laura Wooster. After my update, we'll open it up for questions. You can submit them at any time by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live. So today we'll cover health insurers' latest attempt to retroactively deny emergency care and ACEP's response, surprise billing implementation update, and how our meeting with CISAIO went, the emergency temporary standard for COVID-19 that OSHA recently released, ACEP's partnership with the White House to vaccinate patients from the ED, and a first look at some of our newly confirmed sessions and speakers for the LACI conference in July. On June 4th, United Healthcare announced a new policy that would allow them to retroactively deny or severely limit coverage for emergency department visits if it was determined that a patient's condition wasn't actually an emergency in their eyes. Although this policy was only specific to facility costs, ACEP immediately pushed back. After significant advocacy and PR efforts by ACEP, United reversed course on the policy in just 6 days. ACEP's advocacy cut across multiple tactics, which included coordinating our messaging and strategy with the American Hospital Association and the Federation of American Hospitals, a media statement that got very wide traction on Twitter, more than 1 million impressions and thousands of likes and retweets. Our statement led into coverage in major publications, including the New York Times, USA Today, Modern Healthcare, Axios, and Minneapolis Star Tribune, which is United Healthcare's hometown paper. Congress also scrutinized the proposed policy during a Senate hearing with HHS Secretary Becerra. The policy closely resembles one put forward by Anthem several years ago that was ultimately walked back, but it shows that insurers are continuing to look for ways to deny coverage of emergency care. While United is delaying the policy until at least the end of the public health emergency, the language of their statement walking it back makes it clear that they may try to implement this policy in the future. So ACEP remains engaged with stakeholders and legislators to address this issue and protect the prudent layperson standard, and will provide additional updates moving forward. During our last Capital Minute, I mentioned that ACEP, along with EDPMA, was meeting with CISAIO, the group within CMS that is responsible for ironing out the details of implementing the No Surprises Act. This meeting was a follow-up to the official letters that ACEP and EDPMA had sent the agency outlining the strategic and technical suggestions. Throughout the informal discussion with CISAIO staff, ACEP and EDPMA were able to emphasize those key recommendations and highlight aspects of the legislation that specifically impact emergency care. We'll keep you posted about our ongoing efforts to work with the administration to avoid major issues and policies that get implemented. Last week, the Occupational Safety and Health Administration, or OSHA, released its long-awaited emergency temporary standard for COVID-19. This ETS includes numerous requirements around patient screening, social distancing, PPE, ventilation, training, and record keeping, among other things. However, the ETS exempts fully vaccinated workers from masking, distancing, and barrier requirements when in well-defined areas where there's no reasonable expectation that any person with suspected or confirmed COVID-19 will be present. Understanding that employees of different employers share the same physical location, the ETS requires each employer, such as an independent group practice, to coordinate with the host employer, such as a hospital, to ensure that all the requirements of the standard are met. Hospitals would ultimately be responsible for meeting all the requirements within the ETS for independent contractors working at the hospital. The ETS is effective immediately upon publication in the Federal Register, which we expect to be in the next few days, and employers have no more than a month to comply. Also keep in mind that OSHA standards are stronger than simply guidelines or recommendations, and they are enforceable. You can read more about the new standards on Regs and Eggs, ACEP's weekly regulatory affairs blog at acep.org/regs-and-eggs. Last Friday, ACEP President Dr. Mark Rosenberg spoke to Dr. Rochelle Walensky, the Director of the Centers for Disease Control and Prevention, about his hospital's emergency department vaccination program during a live-streamed White House town hall. Dr. Rosenberg was one of 5 healthcare leaders nationally chosen to discuss innovative approaches to patient outreach and vaccine programs with moderators Dr. Anthony Fauci, Dr. Walensky, Surgeon General Dr. Vivek Murthy, Dr. Marcella Nunez-Smith, and Dr. Bashara Choucair. This webinar was part of a broader initiative that ACEP is working on with the White House to facilitate COVID-19 vaccinations from the emergency department. We'll be sharing more information soon, but ACEP will be providing our members with a variety of resources to work with your leadership and communicate with patients about getting vaccinated in the ED. Since we last checked in, we've confirmed some exciting sessions for this year's in-person LACI that's coming up later in July, during which we will be focusing on patient access to MAT, prioritizing physician mental health, and protecting emergency physicians from harmful Medicare reimbursement cuts. In our Breaking Down Barriers, Improving Health Equity Through the Emergency Department session, you can hear from congressional staff and emergency medicine leaders who have been working to identify health disparities and develop policy solutions to create a more equitable and accessible healthcare system, especially for communities of color and other underserved populations. In Medicare Cliff Notes, Reimbursement, Reform, and You, we'll hear from Aaron Cohen, partner at ACEP's Outside Legislative and Regulatory Consultant, Capitol Counsel, and Casey Quinn, Senior Health Policy Advisor for Representative Brad Wenstrup, along with others about how to protect the emergency medicine community from cuts. During the session on mental health support for healthcare workers, we've invited Senator Tim Kaine to speak to us about the Dr. Lorna Breen Healthcare Provider Protection Act that he is the lead sponsor of, and our joint advocacy on this important issue. And then on Tuesday morning, before we start our congressional meetings, we'll hear from Representatives Josh Gottheimer and Representative Brian Fitzpatrick, co-chairs of the Problem Solvers Caucus, which is a bipartisan member-driven group in Congress committed to finding common ground on many of the key issues that are facing our nation. The caucus's co-chairs will provide their perspectives to LACI attendees on healthcare issues in our current challenging congressional environment and possible paths forward for them. Remember, you can register to attend at acep.org/LAC. Space at the hotel is filling fast, and we look forward to seeing many of you in person very soon. So that concludes this week's Capitol Minute. As a reminder, this episode and all others are available at acep.org/Capitol Minute. Now, I'll be happy to take your questions. All right, here's a question coming in. Has United announced when it will start enforcing the new policy to deny EM claims? So the original date for implementing the policy was July 1st. So they had published this in their June provider bulletin. Obviously, as we just covered, because of all the public pushback that ACEP was able to kind of marshal in the media and from policymakers, United has decided to pause implementation of the policy. They said until sometime after the national public health emergency, i.e. COVID-19, ends. So we don't know what date that is, but they did also say that they'll use this time during the pause to further educate consumers and the public about the new policy and policyholders about the new policy. So that to us signals they are intending to implement this once the national public health emergency ends. That the national designation of a public health emergency is determined by the administration. I believe it can only be renewed for 3 months at a time. And I think the next time it's up is in August. I don't expect the administration to declare an end quite yet. So that would then bring us at least into December. So we'll keep an eye on that. And obviously we'll keep an eye on what United does. Another question, do we expect other insurers to follow suit? We're pretty sure that other insurers are keeping a very close eye on this policy and reaction to it and what happens to United in kind of the coming weeks as a result of it. The analogy we use is this is like when an airline puts out a new policy that they're going to charge for, let's say, carry-on bags or to use the bathroom or something while you're in flight. And depending on the amount of public outcry and pushback, nothing ends up happening. Or if there isn't that much pushback, not only does that first airline put that new fee in place, but then other airlines start to follow. So that's the scenario we definitely want to avoid when it comes to the insurance companies in this. So that's why we'll keep a close eye out, and they will continue to make a very strong example to other insurers about why it might be a bad idea for them to try something like this too. I think we have another question coming in. Yep. What additional advocacy does ACEP have planned for if they do enforce the policy? That's a good question. So one thing that we're working on is we have a sign-on letter of broad groups, including provider medical societies, hospital associations, and patient groups that should be closing later today, that we'll be sending to United's CEO, and that is asking them to permanently rescind this policy, not just temporarily. We're pretty excited. I think it's a broad list of signatories that shows kind of how United folks are about this being a really bad idea of a policy. So we will be doing some advocacy and awareness around that letter. And then we continue to talk to congressional offices about this policy so that they can ideally put some pressure on United as well. And then if United actually does move ahead with trying to implement this, we will do a lot more advocacy and awareness raising, especially in some of the local markets where this will start taking place. Another question. What are the next steps with regards to surprise billing implementation? So the most immediate next step is that by July 1st, we expect to see the interim final rule that's coming out. So that rule is right now at the White House Office of Management and Budget, what's called the inspection desk. And it's undergoing final regulatory review. And actually ACEP and EDPMA were able to meet yesterday with policymakers at OMB to once again highlight our priorities and our concerns with a regulation around this and make sure that they know kind of where we stand. And so that was a really successful meeting, and we're really pleased that we were able to have these opportunities both with CSIO and then with OMB to talk about our priorities with regard to this regulation. So the interim final rule will be out by July 1st. That's mandated by the No Surprises Act passed by Congress at the end of last year. So we'll be seeing that then. And then after that, the congressional legislation had two more kind of time points for other regulations, either draft or either proposed rules or interim final regulations. And one of those was going to be September, and the other would be by January 1st. January 1st is when the full law goes into effect. So what we have seen, though, is that the Biden administration has put out their kind of regulatory timeline that's not set in stone. It's kind of putting out like their planned schedule of stuff. And it looks like they may, instead of doing two more regulations to implement this, they may only do one more. And that would be probably sometime in either end of August or September. That doesn't surprise me too much, because if they do end up going that route, even though they had kind of divided things up for the regulation, for example, this first interim final rule is supposed to be on the qualifying payment amount, then the kind of one in December would be on the independent dispute resolution or arbitration process. Everything in the law is kind of so tied together that it's hard to write two completely separate regulations on this. So I imagine they're just trying to collapse some of this together. And if they do put something out in August, that does give us time, hopefully, for it to be a proposed rule and not an interim final rule. And so then we can weigh in a little bit more on helping to shape that. But even if it's an interim final rule, having it that early gives stakeholders, both on the insurance side and on the provider side, time to implement this. There's back-end billing systems that will need to be addressed. There's forms that need to be changed, communications from hospitals or physicians to patients, especially on the scheduled care side, that are required by it. So, just to have this go into place January 1st, but only get the rule on that December 31st would really not work. So this does make sense. So that's kind of what we're expecting to see coming up. We have another question. So can I submit a complaint if I think my employer is violating the new OSHA standard? Yeah, no, you definitely can. This is an emergency temporary standard. And as I said, that there is enforcement that applies to it. And so to do that, you can issue either an OSHA complaint or a whistleblower complaint. And you can do that on the OSHA website. But if that's something, also welcome to reach out to us about that. If you have any questions before you submit a complaint or consider a complaint, we're happy to talk to you. And the best person to reach out to is Jeff Davis, our Director of Regulatory Affairs, and he is at jdavis at acep.org. One thing to note that I didn't cover in my update on the emergency temporary standard is that it only applies to healthcare settings. So it definitely applies to you all. But I know that there had been a pretty strong push nationally for an emergency temporary standard for other workplaces, including things like grocery stores or places where people were coming into where employees were coming into contact with kind of big groups of the public and probably were at greater risk. That ended up, the administration ended up only doing it for healthcare settings. It took a while for this to be put into place, and it sounds like their thinking was by now, with vaccine rates going up and hopefully continuing to go up, that it's not as necessary to have in other non-healthcare workplaces, but within healthcare, certainly it's important. Another question is, if I do submit a complaint, how do I know I won't be punished? That's a good question. So there is clear anti-retaliatory language in the emergency temporary standard, which would make it illegal for your employer to fire you in any way or in any way discriminate against you for speaking out and identifying areas of potential non-compliance. So, I think if you're worried about your safety or the safety of some of your coworkers, I think it's something to consider doing. Certainly, if you feel like you haven't gotten anywhere with your hospital administration or your employer, then this is at least an additional avenue for folks to take if they need help. Another question is ACEP or the White House working with other organizations on the Vaccinate and the ED program? Yeah, we are talking to other organizations and seeing how we can share resources or amplify each other's efforts. Nobody wants to reinvent the wheel on these. So we have been talking to a number of different organizations. And then the White House itself is working with all sorts of other organizations, including other provider groups, such as other medical societies and hospital groups. And so we're all sharing information that way as well. So hopefully more to come on that we can start talking about with all you and update you further. Another question that's come in is, when is the deadline to register for LAC? So deadline for registering for LAC itself, I would imagine, is probably about 2 weeks before the day. And so LAC, the congressional meetings are on Tuesday, the 27th. So I would say we would need to have registrations by at least 10 days out so that we could schedule those congressional meetings. But I should note that the hotel block guaranteed room rate, that ends July 1st. So if you want to get that rate, which is quite a good one, I know it's gone down, and have a protected, be assured a room for LAC, you'll want to book your hotel by July 1st. And there'll be more information coming out on that, so stay tuned. So with that, thank you again for joining us today on the ACEP Capital Minute, and we'll see you back again in 2 weeks. Thanks, everyone.